So what drew me to it, it does combine the art and the science, and the physicians who are performing cosmetic type of surgery and hair transplants are, we all have a bit of an artist inside us, and it brings that out. So you are in a way creating art, as well as we all went into medicine because we love science and surgery, and it's a perfect fit because you're combining the science and the basic sciences as well as the surgical and medical, and then you're combining art, and all together it's a great field to be able to do that. At the same time, you do develop a relationship with the patients over a long period of time, and for me personally, and many other physicians, there's a certain satisfaction that you could, take from having a transformation of a patient from one end of the spectrum at the beginning to, a full head of hair, or something that's really changing for them. To me, that's gratifying, satisfactory. A patient with relatively extensive hair loss and who may need 3,000, may need 4,000, may need 4,500 grafts can come in now and have such a session in one sitting in an efficient way, versus many years ago where you needed to do 1 or 2 or 3 sessions to achieve that quantity. With follicular units and with the methodology we're using to create an ultra-refined follicular unit technique, you can achieve an undetectable hair transplant. And to me, that's a very, very important thing, because patients want to go out in the real world, and no one should know they had a transplant unless they want them to know. And that's very important, and I think that's what patients like, and that's what we're able to provide. And if you're a physician and you're able to provide that, it's invaluable to the patients. And I think, I know patients expect that, and the educated patients will expect that, and that's what they should get. First of all, they should, obviously come and meet with the physician directly. In my office, I will always meet the patient before any surgery, and that's an important step for many reasons. One, because I am doing a surgery, I need to know what the patients are looking for, and what am I able to provide, and to have a realistic expectations. Hair loss affects a lot of people, and the community is very large, and there are support places, internet forums, and other patients, and sometimes the source of that can come from the physician. So basically, someone suffering from hair loss, and because there are so many options, is to go out and seek and do the research, and do lots of research, and meet many different physicians, and get a take on their approach, and talk to patients and look at their results and see what suits you better. And I think there's often, a certain approach may fit a certain patient that may not apply to another patient, or another perspective from another physician. And because hair loss is a progressive, ongoing process, to be able to communicate well with the physician who's treating you, and don't let travel be an issue. This is a lifetime changing, opportunity and treatment, and if you're able to find a physician who's far away, don't let that be an obstacle in your way. some new patients coming in either have an extensive knowledge from their own research on the procedure from maybe a layman's point of view, and some come in with minimal information. My first role meeting them is to want to see what their goals and what their expectations are and what they're looking to achieve, and assess what their base knowledge is, and working with them to either educate them, to inform them of their options. So after a first meeting, which could take an hour and a half consultation, we have kind of come to a conclusion of what we want to do, what the patient likes to do. And in many occasions, I will see a patient once again or 3 times until they're very comfortable to proceed forward. And to me, once they're ready in terms of their knowledge and informed information, I will be more comfortable myself to proceed forward. I mean, to achieve a great result with a patient, you have to have the ability to perform the surgery at a high caliber, and that could involve using the right equipment, the microscopy, the right type of tools, experience using these tools, and well-trained staff. We have a team of 11 staff members who the majority have been with me for 11 years, and in this way, over the years, you've accumulated extensive amount of experience, and that's invaluable when you're doing a larger session. It's something that you can learn, you can study, you can go to meetings, but experience is ultimately what really counts at the end of the day. You know, we have an extensive quality control, and where the more experienced staff will teach the newer staff and so forth. And this way, and the top of the pyramid is myself, where I'm always ensuring quality control. And that's important because there's many steps in this procedure, and with each step, if you can improve 20% in each part of the step, at the end of the day, it's very cumulative. And the ability to do all of that, put it all together, will take many years to achieve, and you know, we have done that. I'm typically happy with what we've done. The scientist in me, there's always, you know, room to change and improve. However, I like the results we're doing. It proves that we're on the right track as far as the techniques we're using, and the approach we're taking with the patients. Plus the feedback of the patient, that on one hand they're very happy with the results. It's positive reinforcement. You know, when you see a very natural, undetectable transplant that you've helped create, you know, it's a smile on our face, the staff and the patients.